other than putting that on you, propping you up with pillows. You can read your book, you can look at your Kindle, you can watch a movie, you can take a nap, we'll turn the lights off, whatever you want. It is your time. So I'm going to take a look at some before and after pictures. These are at all different time ranges afterwards. And no, I don't plan on just showing you pictures of people who are a size 0 beforehand, who are a -0 or -1 secondhand. We want to talk about realistic things. For myself, I made sure that I let the staff use me as a guinea pig as we were beginning to learn how to do these treatments, because I felt like I was a more realistic body shape and type that could be more relatable to most potential patients. Because you got to know that something might be applicable to you. Not everything is applicable for everybody. Not everybody's a candidate for CoolSculpting, and we're going to talk about that also. So here's a person that got some pretty good results. They were not particularly heavy set to begin with, but these pictures kind of demonstrate the wide variety that you can do with CoolSculpting. You don't have to just treat the same way each and every time. Like, for example, this person here, from here to here, about 2 months afterwards, had just a single large treatment on the abdomen. That single large treatment, I'm guessing that this was an Advantage Plus applicator, which equates to 2 cycles. Just with that same single application, got a significant reduction, but there's still a couple of pockets, and that was able to point out that there was still some individual but somewhat asymmetrical pockets left. So then the second time they got treated, we went ahead with 4, placing them over those remaining little pouchy areas. Now this person had treatment both in kind of the love handle area and the abdominal area. And really, as we look at this person's abdomen, we can see 2 distinct peaks here, and then a kind of a generalized flow here with a definite line where this fat pocket ends. And then we can also see some fat pockets here and here. So this person had some treatments on the flanks and then upper and lower abdomen to get this result. Again, infinite variety of what you can do. So this person started off with just 2 abdominal treatments, and then after that there was a little bit of asymmetry, which was already there but just couldn't be seen because of how that particular pocket of fat was pouching out. So then we could fine-tune and change the orientation of the remaining treatments with one across the top to get the result that they wanted. And here's yet another one. So here's even yet a different shaped abdomen. So my point is that we can fine-tune anything to any shape, any person, to try our best to match up the results that that individual person wants. No one person gets the exact same treatment. So now this person, clearly not overweight, someone who works out, but has some asymmetry in what's left as far as some small fat pockets. So again, able to individualize placement 4 different cycles right over the areas where this person still had an issue, and look, we're able to even everything out and smooth everything out. Men come in too. This person had an issue with what they considered to be their love handles here, and then a little bit around the area below the belly button, and we're very happy with this result, just even with that little bit of trimming with the love handles on the side and a little bit of change. Sometimes that's all patients want. They just want to take that extra inch or 2 off, or just contour something a little bit more. Here's another example, male patient. And you can see we definitely got some debulking here. Here's another one. Now this one, to me, this is one of the stock photos. Now this person got 4 cycles and then got that repeated. I'll have to be honest, I'm not sure that all that was necessary for the results that they got. I think we could have achieved similar just with the 1. But definitely, you can see an impact here on the love handle side, and a little bit here as well. But this is only 6 weeks after. And then the back fat. This is particularly satisfying for a lot of female patients. Sometimes when you're looking in the mirror and you've got your favorite shirt on and you're like, I look so good, and then you look back and you're like, really? Because you see that little bloop right there, like the back boob as we call it. Those are particularly satisfying to get rid of.
Then
I
you're
will
like
tell you that right now.
Stretching your shirt.
You're stretching it, you're trying to pull your shirt to make sure that doesn't show. Yeah, you don't have to do that anymore. We can take care of that for you. Same thing here, and now this illustrates again, remember how I said that almost no one is symmetrical? Well, this person definitely is not. We've definitely got some different place folds and a wider pocket of this upper flank here on the patient's left versus the patient's right. But with strategic placement, this person ended up having 3 treatments up in this pocket where it was a little bit bigger, whereas only had 2 everywhere else, and we got a pretty even result. Again, more with the back fat, definite difference from here to here. This one too, more of the love handle concern, and yeah, shave those down. Same thing here. This is a very satisfying one to do as well. The submental area right under the chin. Oftentimes just with 1, maybe 2 treatments, we have what's called the Cool Mini Applicator, which fits just directly behind the chin bone here. That treatment's, it varies. It can be as low as 35 minutes or can go longer depending on the person and what they need done. This is a very satisfying one. I have found just from experience that you can almost take 10 years off someone's face just by reducing that submental fat some. A lot of people like that. Patients have said that sometimes when the cooling starts with the submental, they may get a quick moment of claustrophobia or feeling like their throat may be numb when it's not actually numb. It's just that cold can fan out a little bit. So that's something to keep in mind when you're treating those patients, that you make sure you have them sitting up, make sure that their head is pat, make sure that they're comfortable enough to continue. Same thing, more submental. So, I mean, great results with that. And this one, of course, not as prominent as the other 2, but still a good result. This one here, very good result. This one also. Definite improvement there. Now, the Tricep Twinners, as I call it. Sometimes you've just done everything right and you've lifted weights and you've done everything you need to do and you still can't get those Jennifer Aniston arms. We can help you with that last little bit of uncooperative fat there and smooth that out for you with CoolSculpting also. Sometimes with a single treatment. Same thing here. Now this isn't as dramatic a result, but again, this was only 1 treatment. The thigh gap. Who doesn't want a thigh gap? Not everybody has one, but we can help you get closer to having one with CoolSculpting. So we do inner thigh treatments and outer thigh treatments as well. You want to make sure though, if you could have a very thin patient or you could have a very much heavier patient who might actually not be a candidate for CoolSculpting of the thigh area, we have to make sure when we're doing CoolSculpting in the thighs, especially outer thighs, that the patient has a definite pocket of fat that is noticeable right along the hip flexor here. If they do not have that, they are not a good candidate. Same thing for the inner thighs. If they don't have that semi-discrete pocket that we can actually treat, you run the risk of indenting the area between the legs, and that's not something that you want. So you've got to be careful. You make sure you evaluate your patients carefully. Here again, some inner thighs CoolSculpting. Now, this patient had some CoolSculpting of the inner thighs, but a little bit more posteriorly. Same thing again. Same thing again with the thighs. And this patient had, now this